Central Valley, 1 in 6 kids has asthma and many more go undiagnosed. But at Community, a program focused on educating families about managing childhood asthma is changing that. The air in the Central Valley may look clear, but it hides dangerous triggers. Pollution and poor air quality get trapped by the region's geography, making it one of the toughest places in the country for children with asthma.
So typically it's 1 out of 6 children in the Central Valley have asthma, many more undiagnosed.
At Community Regional Medical Center, the Pediatric Asthma Program offers more than just a treatment plan. It offers clarity in the middle of a storm for so many parents. It offers specialized testing and hands-on education, the only program like it in the Central Valley.
With asthma education, we actually educate not just the kids, but the parents as well. We want to find out what the triggers are, what causes our asthma attacks. We provide an asthma action plan.
Parents learn how to recognize the signs of an asthma attack and how to stop one before it even starts.
And it's real important. You think it's just squeezing the inhaler and the medication goes in there, but we show the importance of using the spacer because most of the medication that you squeeze in, actually the patients actually end up swallowing. So when you use the inhaler properly, they get most of the medication.
And the learning starts the moment a child walks into the building.
When the patient comes in, the RT is actually the first to see the patient. We go in and do spirometry. We assess the patient, whether they are going to do spirometry or the FOT, the oscillation machine. The pulmonologist will go in there and see the patient, go over the results. And then once the patient is done with the doctor, he'll come in and say, okay, this patient will need some education. Can you come in? That's when I go in, I sit with the patient. We go over all their medications, what they do, how to use them, when to use them, spacers, anything like that.
From preschoolers to teens, every child gets care tailored to their stage, even those too young for traditional asthma tests.
We are the only clinic between Sacramento and LA that offer this exam, the oscillation machine, and for patients 5 and below. We typically start testing around 3 to 5 with that machine. Sometimes we have 2-year-olds that are able to do this test. So it's incredible, huge indicator for asthma on those smaller kids.
For parents like Alexis Canada, the asthma program has made all the difference as she navigates her son Kobe's asthma.
And it's really sad just trying to watch your child struggle with breathing, and they, really can't kind of get their airway open.
Kobe has been hospitalized twice for asthma. Now the program gave Alexis more than a diagnosis. It gave her a plan.
So the second time he had the flare-up, they told me that they wanted him to see a pulmonologist, and then they told me to also come here to kind of get treatment plans and stuff for him and show kind of everything to do, steps to take for his asthma.
Now, Alexis is hopeful that with the right tools, she can help Kobe manage his asthma and let him just be a kid again.
Asthma never goes away, but just for it to kind of subside a little bit as he gets older, because I do want him to be able to play in sports.
And for the asthma program team, that's the goal, not just to treat asthma, but to empower families for life.
To see a patient come in with such disparity or just scared. A lot of the times you just walk in and they're just, holding back in the chair, and you leave the room at the end of the conversation and they're just so much more relaxed, they're engaging, they're expressing, they're opening up so much more. That is so rewarding.
For more information on Community's Pediatric Asthma Program, visit communitymedical.org/pediatric asthma.